Hey guys, so before we start, I'm thoroughly aware of how absolutely crappy I look. I was just angry crying and fuck. Got all these like water cans over here, and I've been extremely upset. It takes a lot for me. If any of you have any history with my YouTube channel and my blog and all of that, you all know how much it takes for me to get to the point where I'm crying. Master her emotions and all that. But let me tell you what's going on here. And this is for all my chronically ill, disabled, mentally ill people out there. I know you can relate to this. And I am just fucking livid right now. But I wanted to make a video about this because, and I will follow up with this to let you know how it all goes, because I've always talked about how important it is to advocate for ourselves, because we're often, as chronically ill people, fucked with within the medical system and not getting the care that we need, especially as chronic pain patients. And as you all know, I've got serious chronic pain. I have a Vascular Ehlers Danlos syndrome, and as a result of that, I also have severe arthritis in my body, and I've got constant pain that is 24/7. It's not like flare-up pain. I've got pain all the time, and it took me a long time to get pain meds. I had them for a while when I was living in Hawaii in the early 2000s, like 2003, 2004, 2005. I had good pain medication, but then we had the opioid crisis, and then that all went to shit. And so for a very long time, I was without pain medication. I didn't get it again until like this last year. So you can imagine how shitty it's been, and how hard I had to fight for that. I finally found a doctor that referred me to a pain clinic, and he was the only doctor I've ever gone to who's also a physical therapist and a pain specialist, who was familiar with Ehlers-Danlos syndrome. And he was like, oh, I absolutely understand how much pain you are in, so please don't worry, I'm gonna give you proper pain medicine. He's like, let's start off with tramadol, because I know you haven't had any pain medicine in a long time, let's start you off with that. And he explained to me, he's like, there's a difference between addiction and dependence. He says to me, because I was like, a bit concerned. I'm like, dude, I don't want to get addicted to this and then have it not work for me, and then having to keep upping my doses all the time. I don't want to become an addict, I've got major addiction in my family. So that was something I was concerned about. My son was an addict, and he's no longer with us. That's a whole other story. So you can imagine this is a touchy subject for me. So he told me, there's a big difference between dependence and addiction. He's like, dependence is when you are on a medication that is going to help increase the quality of your life and make you able to have some semblance of a life and, mobility, and to be able to get out there and enjoy yourself, as opposed to just rotting in bed all the time, which I'm still working towards. If you've been seeing my recent videos and reading my blog at all, so tramadol wasn't, really cutting it, because it's a really weak drug. It's kind of like taking acetaminophen, but it was like occasionally on lower pain days, it was kind of taking the edge off, So my PCP, I was aware of this, we're all in cahoots with each other. But the great part of the story with the pain specialist was like, he's like, I have a couple other Ehlers-Danlos patients, but they've never been around when my students were here. Would you mind, having my students be able to take a look at you? I'm going to have them guess what you've got, because they've never seen someone with EDS before. And so he takes me into the room, and they all file in. There was like 12 of them or something like that. And he says, okay, Ms. Monday, will you please show them what you can do? I'm like, oh good, so I get to do my stupid human tricks, which I always pay for later on, but I'm like, for the future generations of doctors who will hopefully be able to treat us properly, I will do my stupid human tricks. And so I did my things with my fingers, and I did my joints, and I touched my palms flat to the floor, with my knees bending backwards, and all that stuff. And one student finally was able to, and then he described my pain and further of my symptoms. And one student almost right away was able to say, "Is it Ehlers Danlos?" And like her eyes were lighting up. And other students, because we were all like at a loss, like, I don't know, but her body's freaky, you know. And so she guessed it, and they were like, "Oh, Ehlers Danlos, Ehlers Danlos." And they had a bunch of questions for me, and he made a huge point of saying, this woman is in pain, a lot of pain, 24/7. Her life is, you know, her life is basically ruled by her pain. And he kind of gave them this big lecture about how important it is to properly treat the pain, and, you know, how physical therapy and heat treatment, not cold treatment, because that's just going to make it worse. Things like strength training with, not with weights necessarily, but with things like Pilates, and how yoga is counterproductive because it will further stretch out ligaments and tendons and joints, which I hadn't known for a while, and I was doing yoga and making myself worse. So just, you know, he was very helpful. In any case, so he's the one who started me on tramadol, and then my PCP, Dr. Taylor, was the one who decided eventually that I needed to go on to something stronger because my pain was getting much worse, especially since I started getting the symptoms from the Fibromuscular Dysplasia. They can also, if it's a severe enough case, it can cause pain all over your body too, in different areas. And then my arthritis was getting worse too, like I can barely use my hands. So she put me on very low dose Norco, like 7 milligrams of, you know, the hydrocodone, which is not a lot, and only twice a day. She asked me if I wanted to start her 3 times a day, but, you know, I'm always very mindful of coming off as being a drug seeker. So I said, well, let's start at 2, and then if I need more, she's like, you just let me know. She's like, I know that you need pain meds. And so that was fine. But then she was going on maternity leave. So just a few days later, I was like, I know I need more than this. And so I shot her a message on the, you know, whatever, like the, you know, the medical, there's like you send emails to the hospital system or the team system, asking if we could up it to 3 times a day. Well, apparently she'd already left for her maternity leave. And I get this message back from the new nurse practitioner who's apparently taking over my care. And this is what I get back. Thank you for reaching out. Taylor is not in the office today. I do not think increasing your medication to 3 times a day is a good idea. I see from your notes that you are trying to avoid narcotic pain medications. No. Continue to use the medication that you have and add ice packs and stretching. The 2 things that I should absolutely not be doing. I would continue normal activity as you're able and prioritize sleep. As you'd be reading my notes, I do not have normal activity except for I'm bedbound, and I sleep too much as it is anyway because of the pain. I'm looking forward to meeting you later in the month. Perhaps a referral to rheumatology would help since you are not happy with your pain specialist. We've discussed many times how rheumatologists do not necessarily help people with EDS, and they're certainly not going to help someone with vascular EDS. And then never once did I say I'm not happy with my pain specialist. What I said was I tried calling this guy for another appointment and called 5 times and never received a call back. For whatever reason, his office staff is just subpar, and I just kind of gave up and asked for a referral to a new place, and they did not take my insurance. So she's clearly just not even read my chart. We will talk about this at your next appointment. If you have severe pain or an injury, please go to the ER. Right. And then I woke up this morning and had a message from her on my voicemail, basically saying, I'm not sure that the Norco is the best choice for you for your pain medication. So probably this is something we should discuss and look at alternatives for you for your pain meds, which basically means she wants to take me off the Norco. So we'll talk about, you know, pain specialists or pain clinic or something, and, you know, we'll talk when you come in again. So I was just like, oh my God, they're gonna take away my pain meds, and I'm gonna be right back where I started. And I am I'm in such severe pain, you guys. I'm getting upset just talking about it, you know. So I sat there and I just was like, fuming and so upset and just ready to scream, you know. And then I thought about it, like, okay, what can I do? I can't just sit here and do nothing, and crying about it's not going to get me anywhere. So I thought, what are my options here? I can't just scream into the void, and I can't, you know, Dr. Taylor's on her medical leave. What can I do? Well, my clinic is through the social service agency I'm with, and I have advocates through them. So the first thing I did is I messaged back this Sarah person who is she's basically like a nurse practitioner. She's not even a doctor. So I wrote back to her, Sarah, I am not trying to avoid narcotic pain medications per my pain clinic. Taylor suggested we would increase the dose if needed, as she is quite familiar with my severe pain. I was the one who asked that we start with twice a day and see how it goes. If you were aware of how my pain operated, you would know ice packs are the last thing that works with EDS and arthritis pain. Stretching is also unhelpful for EDS as it further injures my already overtaxed ligaments from overextension. Please confer with Taylor. I do not have flare-ups. My pain is constant and daily. I sleep more often than I am awake due to pain already, which she is also aware of. I'm also not unhappy with the pain specialist. He simply never returned my 5 calls. Please become more familiar with my case. P.S. I can see I am being treated like a drug seeker. I would like to be referred to a different practitioner and have this conversation recorded in my notes and be CC'd to Taylor. Thank you. Also, for the record, I have saved the transcript from your voicemail to me where you say you don't think the pain meds Taylor prescribed to me are the right ones, overriding her decision. I'm contacting my caseworker, Kiara, to inform her of this as well. I had to fight to get proper pain treatment and will not be treated like someone who does not need this medication, especially as, from your message, you clearly barely skimmed my chart. Thank you. So I sent that off to her. And then I contacted my caseworker, the social worker, Kiara, and told her in detail of this conversation and what happened. And I will have her coming with me, her, one of those other social workers coming with me to all of my appointments that discuss my pain medication. So I'll be fighting my ass off to retain my meds. So this is really all I can do at this point. You know, it's just, I'm on, the only lower dose of Norco from 7 is, I believe, like 5 milligrams. So I'm just, I can't even believe I'm having to fight for this all over again when I already fought so hard for so long to get this. I'm just, I can't, like, my head is fucking pounding right now. It is so upsetting. So, you know, I know that some of you are aware of this sort of thing because you've done it before, but, you know, you have to advocate for yourself. I mean, there's no point. I mean, obviously you can't control your emotional reaction to stuff like this. You and I can't, and it's extremely upsetting, and I'm just, you know, I'm just making myself sick being upset about it right now, but it's, you know, so most likely I'm gonna have to be, or possibly I'll have to be referred to another pain clinic, which is fine. You know, but I'm canceling this appointment with this person, and I'm gonna have them contact Taylor because this person is just like an interim provider until she comes back from maternity leave. You know, first of all, like, why is she fucking with my meds? You know, I am, if anyone is in need of pain meds, it's someone like me. You know, I'm so pissed off and insulted and being treated like a drug seeker again. I can't even, I mean, you know, I will be just, I'm already stuck in bed as it is. I will be, I mean, I can't even describe what the pain is like to you guys. It's just, I mean, I've wanted to open a vein many times because of the pain. You know, it's not worth it. It's not worth having to live this way if I can't get pain relief. And people wonder why people go to the street to get illegal drugs. It's because of shit like this. It's not because, you know, the doctors overserve us with pain medications. It's because they refuse to give us pain medications that we need. I just, mean, just the fucking entitled attitude that she spoke to me with. And the fact that she clearly didn't even look at my chart. She clearly didn't bother to familiarize herself with what my condition is like. Cold packs and stretching. I mean, that alone tells me that she didn't look at shit, you know? I mean, dear God. I mean, we have to advocate for ourselves so hard, and it gets so exhausting. So exhausting. I'm so nauseous right now. I'm just so fucking angry. You know, no wonder people go fucking postal with this shit. My God. I'm just so tired of it. I'm so tired of this. And I thought at least this part of the fight was over. You know, I really, really did. I can't believe it. Oh my God. So yeah, that was my first thing I woke up to today. And yeah, so God. So yeah, it's too late to cancel my appointment because I woke up unfortunately too late because I was up most of the night last night again because my fucking schedule's all turned around. But yeah, I'm gonna set my alarm tomorrow and cancel that fucking appointment and call the social worker again, and because they're understaffed. But there's like several people on my team. I'm gonna call another one of them. She was the head of my team that I contacted, but I'll contact another one of them, and I'll see one of them on Monday in person. So this has just got to be dealt with as soon as possible. You know, you know, what the fuck? How can they look at someone like me with my conditions and think she's drug seeking or she doesn't need that medication? Yeah, just stretch and put ice packs on it and sleep. Like, I hope this bitch gets chronic pain. I really do. Like, anyone who treats me or any of us this way, I just hope to God they get hit with chronic pain real bad and that someone refuses them help. You know, that's all I can do is, that's the first thing I wish upon them, you know, aside from a slow and painful death. I'm so fucking mad, can you tell? All right, I'm just gonna shut up now and fucking watch the second season of Sandman since it's available. I'll talk to you guys soon.